Welcome back to 7997 with your host, Chris and Jackie, two black immigrants living our best life in Mexico. As you see, we're here, whole family today. We really want to kind of share a story with you guys about sort of the medical trials, tribulations, and triumphs in the Mexican and U.S. healthcare systems. So before we start, I want to have everybody introduce themselves. I'll start with Mr. TyroneDickey here. He's sort of the heart of our story here. So we'll have you kind of start and introduce yourself, Ty.
No pun intended. The heart of the
Uh,
story.
Absolutely.
Hardest. Hey, I'm Tyrone Dickey, aka Ty, of the husband and wife team, clothing team of Steph and Ty. On August the 3rd, uh, I was having chest pains, and actually, August the 3rd was me and my wife's 33rd anniversary.
Mm.
So I woke up and I told her happy anniversary, and but my chest was hurting really bad, and she asked me would I like to go uh, to the emergency room, and I said no, because we got to pay for that, because in Mexico everything is cash, and I'm like no, I don't feel like coming out with thousands of dollars just to get checked up. But it just got to hurting so bad, we got a Uber over to the hospital, uh, emergency room. They admitted me right away, and did what they do, and came back with the diagnosis of my heart that has been torn. Like I never knew that could happen, and so that was the first day in the hospital, and then the second day in the hospital, and this is Mac Hospital in San Miguel. And then the second day, they were like, "Well, you need emergency surgery," and but they couldn't do it for on me because they didn't have the technology to do it, and they didn't have the surgeons. So they told us about another hospital that was like about an hour away in Quetro that could do the surgery on my heart, but they needed to have $130,000 in cash, American cash, as a deposit, and we're like, what? $130,000? Who has that kind of money laying around? And I'm sure there's people that do have that kind of money laying around, but the Dickies were not that couple. And so I called my sister and asked her about maybe doing the surgery here in Houston. And she went out. this this really brings tears to my eyes. She went out, found me a surgeon, and they said they would do it here in Houston. And technically, at that point, I only had 2 days to live, and I lived 10. And they got me to Houston, man. They got me to Houston on a jet. Not just getting me to Houston, they got me on a jet. And I'm like, wow, blown away, unconscious, the whole nine, but blown away about what happened. And I say this to say, I don't know what my purpose is for coming back. And I want to thank this lady that I do not know for getting them to get that jet to me. And I also want to thank my son. Thank you, Chris, for even telling Steph, like, check with your insurance company. And I'm back. I'm not at my best because I've been very depressed with this, because this is more than an ocean. Because not only have I had the heart surgery, I've also had lung surgery, and the doctors is telling me, man, we didn't think you were gonna live. You know, all that blood in your lungs. When I saw it, I'm like, he not gonna make it.
Mm.
And when I came out of coma, Steph was grabbing me and touching on me and just crying and crying. And I'm like, what is going on? And she's like, I never seen you like you were dead. You were dead. And I'm like, what? So I'm here for back for a reason. And I guess the things that I've done in the past, I got to do more. And I got to give a little more and bow down a little more. So I do appreciate life even more now.
Amen.
So let's take a
Amen.
minute and I mean, this story is just, it's amazing. And let's rewind just a little bit and we'll kick it over to my mom, Steph. Give me a little bit of the outlook of like what did life look like in Mexico for Ty here before that day came up when he really had to go rush to the hospital. Like,
Right.
what was the healthcare system like? How was, he being taken care of by the doctors here? Like, what did it really look like before he kind of got to that place where it was just too much and we got to go to the hospital?
Right, right. Well, actually, this was our second trip to Houston for medical treatment. But when we came here originally, I was pretty pleased with the healthcare system. And I still am to a certain extent. Because the medical doctors in Mexico really do care for their patients. I give them a lot of credit for keeping him alive for that time period while we were trying to get logistics straight to get him back to the States. Um, Also, we had like our regular primary care doctor there in Mexico. We had the like Dr. Garcia, who was like a local doctor who still makes house calls. So if something happens, like we had a couple of incidents where like I had a shower door fall on me and I got cut up pretty bad. And so he comes to the house. I had a really bad reaction to some mosquito bites one time. He comes to the house. So you call your doctor, he will come to the house and take care of
Mm-hmm.
you.
Mm-hmm.
Even there was a time when Ty got really dehydrated, and they came and they brought a nurse and they brought the IV and they hooked him up to the IV in the house in his bed. You know, the medical system there does take care of their people, and technically they have free public health care, so that if you're even a resident, I think even people that are visiting, if something happens, you can go to the public hospital for free. Now, the public hospital may not have the best facilities for major stuff. If you break your leg or you get the flu or something like that, it's great for that. If you're having heart surgery, it's not great for that, because even the private hospital that we were um, at Mac Hospital didn't have the facilities to handle a heart surgery. So that's why they had to approach the hospital in Querétaro, which is like the next about an hour and a half away, because they have bigger hospitals. And even with that, part of the reason why they required such a large cash deposit in advance was that they had to get stuff. They didn't have everything that they needed there either. So they were going to have to get some stuff. They had, a good portion of the equipment, and they had a heart surgeon that could do the surgery. And the heart surgeon traveled from Querétaro to the hospital in Mac to meet Ty and to look at his charts and everything, and see what, if this was something he could do, which I don't think that's even heard of in the States either. So, there was a lot of things that I give Mexico credit for. If you're going there, if you're thinking about relocating, and you are maybe younger or you don't have major health problems, um, then it might not be as big an issue. The one thing I would say that if I had known, I would have thought maybe twice about the whole situation as far as permanently moving. Is that, as you get older, when things go wrong, it's more likely there's going to be something big that goes wrong. It's not going to be as maybe not as minor health issues. And the U.S. health insurance does not cover you in Mexico. Now there are some travelers insurances that you can get that will take care of some emergency situations. There's a group that started in Lake Chapala, I think, in the Ajijic area where there's a lot of expats, and what they do is they work with with your Social Security Medicare situation, and they will negotiate with Medicare and have Medicare turn the payments for your service over to them, and then they will pay the Mexican hospital. So that way, what happens is they make their money because what Medicare will pay them and what the Mexican hospital charges is a lot different. So they make their profit in the difference between the two, which to me is good, but slightly shady. You know what I'm saying?
But at least you can get some help. So
yeah, but at least you get some help. Now, the only issue with that is that Mac Hospital in San Miguel had stopped dealing with them. I guess they thought it was a little slightly shady too, or maybe they had some issues with them because they used to take them, and I had actually signed up for it, thinking, okay, well, this might be a way that if something happens, I can have things taken care of. But of course, Mac Hospital says, no, we're not doing that anymore. So, yeah.
Plus, Tyrone doesn't qualify for Medicare.
No, that's true. That's true.
So
it was only good for me because
Right.
it was only good for me.
You got to put that in there.
He doesn't have Medicare. So so even if it had been me, I wouldn't have been able to use it because Mac Hospital said no, we're not doing that anymore.
We're not doing that program anymore.
Yeah. So you don't have as many options. You basically they do tell you that there's a company that you can apply to while you're there in care that will cover you, but you have to still pay up front and they will reimburse you. But what happens is you put the application while you're coming into the hospital and they say, okay, well, if you get accepted, then they will cover you, but it's only if they decide to accept you. But in the meantime, you still got to pay that money up front and that company will reimburse you. So I don't know anyone who has actually had that happen, So, I mean, I don't know everybody. I'm sure that they set that up like that for a reason, but the bottom line is the Mexican healthcare system, unless you're going to the public hospital, it really requires you to pay cash up front, for pretty much everything.
Yeah. So if we recap the story so far, like you have decent healthcare here, can take care of the small things, the day-to-day things you need kind of going on, small emergencies, kind of hit a tipping point with his health. Then we had to kind of get into a bigger hospital. Granted, San Miguel is still small, so even the bigger hospitals here are still pretty small. They don't have,
pretty small,
capabilities we need. And then the possibility was to go to Querétaro, but like, again, it's all cash business. Like you got to pay up front and it's $130,000.
Right.
So to me, this feels like the point where Dr. Rhonda really hops in and starts working behind the scenes on the U.S. side to figure out, okay, how do we get Ty out of Mexico into the U.S. and get him taken care of in the way we need him taken care of.
Right.
This is part of the story I don't really know that well. So like, I'm even interested to hear like, what were the strings that you were pulling in the background, Rhonda, to get, civic doctors to work with him, to get hospitals, to find out where he should be and kind of get him in the best place possible?
Okay. So let me just say this. I'm not going to talk about, I am going to talk about the practical part, but I'm going to talk about two parts. So one of the biggest parts of this, I'm going to start us off with, one of the biggest parts of this was God. So he cannot be left out of this at all, because none of this would have happened without God. My brother, so first, I am Dr. TyroneDickey. I'm a pediatrician by training, and I am Tyrone's sister, younger sister, okay? So when God is in all of this because my brother is a walking miracle, and I need that to be stated and understood and known. Because the condition that he has, which is called aortic dissection, which that means the major artery in your heart that takes the blood from your heart to the rest of your body, is the aorta. So you cannot survive without your heart pumping this blood through the aorta out to your whole body. And so this condition that he has is a surgical emergency anyway. I don't care where you are on the continent, in the world, it's still a medical emergency. So he had what we call the tearing of the aorta. That's what an aortic dissection means. It's like if you see a zipper and you see the zipper coming unzipped, that's really what the artery was doing, coming unzipped. Okay. And so that is a medical emergency. Plus, he also had his aortic valve, since it was coming unzipped, his aortic valve itself, which is the valve between the chambers of the heart, it was also very, very damaged and torn, and it had to be replaced as well. So first, and just going back to what Stephanie said about if you were younger. So what, because I have not lived in Mexico. I've been to Mexico in different parts many times for vacations. But if you go to any other country, period, if you are young and healthy, I'm sure you most definitely would do better. But if you have any major medical conditions like diabetes, high blood pressure, glaucoma, any autoimmune diseases like lupus, Graves' disease, those are autoimmune diseases. Any of those blood clots, cancer, any of these major illnesses, you're going to need multiple specialists and routine medications that are expensive and follow-up. So if you have any of those things, being in these other countries, you need to see what your options are before you go. Now, even with that, you can do your due diligence in calling your insurance companies and whatever. And if you don't get to the right person, they might tell you something false. Okay, so you have to call multiple people and talk to multiple people and read and print what's actually covered when you go to any of these other countries. I won't put that out there. Okay, now, so August the 1st is my birthday. So August the 3rd is their anniversary, but August the 1st is my birthday. So when Tyrone called me, or Stephanie sent me an audio message saying that Tyrone was in the hospital, it was not the aortic dissection going on at the immediate response. It was, he was having chest pain and they were figuring it out. And then one of the incidents that happened was the nurse messed up and made a major mistake with trying to place a tube, and that caused an issue. So there was some trust issue in there because of that mistake. So when we did find out shortly after that he's having this aortic dissection, of course, at that point, Tyrone and Steph was not a little trusting of what was going on in that hospital because of the incident, even though they have done well in the past when Tyrone has gone there in the past. That was one thing. Also, yes, they did not have what they needed there to do the surgery, but one of the main things was he needed the surgery. And so me being a physician, even though I am a physician, I'm just going to put this out there for honesty and transparency. You do not get a hold of cardiothoracic surgeons. It's like you don't get a hold to a neurosurgeon, a pediatric neurosurgeon. Like, it's just things that don't happen in medicine, okay? Especially for minorities, things that don't happen in medicine. But luckily, I have a group that's on social media. It's on Facebook. That's called Mocha Medicine, and it is Black physicians of all types, residents, physicians, medical students, nursing students, dentists. It's just a group that we put together a long time ago. And we help each other. That is what it's for. And so, and we have the major Mocha Medicine, and that's for all of the United States, but we also have a Mocha Medicine subset group, Mocha Medicine Houston. So I immediately got on there when talking to Steph and Ty and seeing what was going on, got on there and say, hey, I need some help. Who can I get a hold of? And so, of course, Houston is the #1 medical center in the United States. So they are used to actually getting patients from other countries that come and get care in Houston. That is a normal thing, especially at Methodist. MD Anderson is our cancer center. We are #1. So that is a usual thing, actually. So I already knew he needed to go to Methodist, but I also knew what the condition was because I'm a physician. And so I was like, I don't think he really can be moved, but let me see. Let me get other experts. That's another thing. You got to humble yourself and get help when it's beyond you. So one, again, God leading me, because it's not just me, because I'm trying to work and do all these things at the same time. It's not me. It is God. So God leading me to seek help. Humble yourself, seek help. So I got on there and was like, this is what's happening with my brother. I need some advice. That's what I was asking for, advice. And the miracle from God was he led me to one of my friends that I do know, who led me to a Black cardiologist. And I sent my brother's information to him. And he looked at it and he messaged me back and was like, from looking at this, your brother doesn't need to be moved. He needs his surgery immediately. He said, but I'm going to send it to my cardiothoracic surgeon. Okay. Cardiologists are the heart doctors, but they don't do surgery on the heart. They just manage heart conditions. The surgeon is the cardiothoracic surgeon. So you got to have both. Okay. And so he sent it on to his cardiothoracic surgeon, Dr. Atkins, at Houston Methodist. And he told me that Dr. Atkins would call me. Now, y'all, when I mean you don't have access to no cardiothoracic surgeon, especially someone calling you.
Yeah. Unless you're married to him.
That's the only way. Are they your parent or child or something? No cardiothoracic surgeon is gonna pick up and call some layman's person he does not even know. I don't care if I am a physician, it doesn't matter. Okay. I've never met these people in my life. Okay. Never. Only one I had was my friend who connected me, right? Okay. So, and he did. He called me. He looked at the information and was like, no, your brother cannot be moved. This is a surgical emergency. We take people to surgery immediately. Don't stop. We take them.
Don't collect 200.
Nothing. We go straight to him. I said, okay. So I go back to my brother and my sister-in-law and say, look, I have talked to the expert. You're going to have to get this surgery here. We cannot move you. You're going to have to get it here. I know we have questions and concern, my brother, because one major surgery. So he's here and he's got this condition. Now he's here and he needs major surgery, in a matter of a day. And they had messed up. So he's really resisted and was like, no, I don't know if we can't move me. I was like, no, Ty, we go. And I'm talking to his physician too, saying, no, we're going to try for this. And that's when he was like, okay, I'm going to get another scan that he needed, as well as get the surgeon over to discuss it with us. That was a Monday. And with all these things, when I say every time we tried to push forward, there was a push back. But my God, see that? My God.
Yeah.
Every time that there would seem like a no, or it wasn't going to work, my God opened another door that would not have been opened in no other shape, form, fashion, way that we ever did anything. Okay. So fast forward, multiple complications with the CT that he needed to get. Ty took the dye, then that picture didn't take. They had to do it again. Ty was getting sick over that. They had to start dialysis on Ty. Meanwhile, we're still trying to get the surgeon over, talk to us, and see what we had to do. And that's when the surgeon finally came on a Friday. This is a Friday. Now, we just said they take people to surgery immediately. They don't usually live without having the surgery. People do not live, y'all. They don't live. Okay. So here it is. That was Monday, Tuesday. Here it is Friday. The surgeon comes and said, yes, Tyrone needs the surgery. We say, okay, but not at that hospital. They don't have the things that they need at that hospital. We need to move him to another hospital where I have the things I need and the people in place. We said, okay. So then we like, okay, well, let's call the other hospital, see how much it costs. Now, meanwhile, again, we're racking up a huge bill. We meaning the Ty, my sister-in-law, racking up a huge bill because he's in there. He's in ICU. He needs dialysis. He has a central line in place. He's getting all these medicines to try to keep his heart, his blood pressure down, and his heart together and stable, because we can't have his tear growing.
Yeah.
Okay. So they're trying to do everything. And I give them, they're trying to do everything to keep my brother alive. So I'm very thankful. So, but that costs buku money. And again, people don't realize, because they're here in the United States, most of us, and not all, so many don't have medical insurance, y'all. So the cost of medicine is the cost of medicine. Even with your medical insurance, if you take time to look at your bill will say $150,000. That's what they technically sent to the insurance. That's just not what you pay. See? So the cost of medicine is still the cost of medicine. Now, Stephanie, I'm like, okay, we're going for it. So Stephanie was like, okay, well, let me get in touch with the hospital to see what the cost is, or at least can we put a down payment of some small sort down for them to get the surgery started and work out the rest afterwards. So Stephanie does. That's when we find out that no, it's $134,000 for them to even touch Ty. And like they said, that was a down payment. That wasn't going to be the total payment of all of procedure and his hospitalization from the surgery. That was just going to be the start for them to touch him. So I had to call Dr. Atkins back and say, Dr. Atkins, I have no other choice but to get my brother to you. I have no option. We don't have $134,000. We can't raise $134,000 to get this surgery done within a matter of days. I have to get him to you. And so he was like, first he was in shock that they were really going to charge. No. First he was really in shock.
He was still alive.
Not at that time. He was in shock that they wanted to charge us this amount of money to get started on the surgery. He was like, we don't do that here in the United States. We just do the surgery and work out everything afterwards because we're trying to save a life. I said, yes, but that's because we're in the United States. That's not how other countries work. So just so happens, still God moving, when I talked to him, his partner is from Mexico. Another cardiothoracic surgeon that works at Methodist is from Mexico.
Wow.
His partner's father is also a cardiothoracic surgeon in Mexico City, Mexico.
Come on now.
So he was like, well, hold on. Because he really didn't believe me. He was in shock. He said, let me call him. When I told him what was going on, let me call him. He called me back in 15 minutes. And he was like, you were right.
Wow.
You were right. They do charge you up front. And right. He was like, and then he said,
a plane ride to ditch your bill.
So he was like, well, they do charge you up front, but my colleague says, get out of San Miguel Cuatro. They don't know what they're doing. He didn't say they don't know what they're doing, but they don't have what they need and the skill. He needs to really be in Mexico City to get this procedure. That's what he said. And I was like, okay, well, can you talk to your colleague to talk to his father and see? He said, but no, that's not going to help you because it's still the charge. So what people don't understand is the surgeon does one thing. The surgeon does the surgery, but the surgeon is not in charge of the hospital. And the hospital is all the things that you need. Okay, the surgeon does the cutting, but he needs the hospital room, the nurses, all the instruments, oxygen, everything that he needs to do the surgery is at the hospital, and that's where the largest bill is, the medication, everything. So they're going to still charge you that large amount, so that's not going to help you. He says it's probably going to even be more because Mexico City is more expensive than the smaller area that they were in. So he said, what you're going to have to do is you're going to have to fly him here. You're going to have to get medical transport. And he started telling me exactly what I needed on the medical transport for my brother. And I said, well, what do I do? Google it? He said, yeah, you can Google it, find it. I was like, okay. So that was 5 o'clock on Friday. Me and Stephanie tag team, and I called her back. We tag teaming at 6 o'clock p.m. my time. Tag teaming back and forth, Googling medical transports, trying to find medical transport. We're
checking everything, including ground transportation, because that was an option too. We were like, okay, we can get him, because Dr. Abel, who was a doctor that we worked with before that got him the oxygen the last time we came to the States, he offered to coordinate an ambulance to get him from the house by ground to the border, and then we would have to call another ambulance at the border to get him from Mexico to Houston, and he would travel with us to the border. He could only go to the border. So we were like, so I'm trying to figure out ground transportation and how we're going to do that and how much it's going to cost. So Dr. Abel is working on that, and he's getting the nurse to go with him so that there'll be the two of them in case anything happens on the road. And I'm thinking, it's a 15-hour drive on a good no traffic, to get to just to get him to the border. And then we got to get him to Houston. And big as Texas is, when you think when you cross the border into Texas, you still got another day's travel basically by ground, and I'm like, he's not going to make it by ground for that long in ambulance or whatever, because we checked out everything, ambulances, people's personal cars, vans, whatever was going that way.
Donkeys, mules, anybody going.
So then when we started checking the air transportation, like Rhonda said, she was calling people, I was calling people, we were overlapping each other. We were trying to get a Mexican airline, medical transport company to get him, to Houston, which they could have done, but again, the cash front situation comes up because the Mexican medical transport needed, what was it, around the 20,000?
Well, I was gonna get to that. Yeah, 21. No, it was 21. So
21. Okay, 21.
That was the USD, right?
Yes, everything is USD.
Everything
is USD. So we tag teaming Friday night. So Saturday, I ended up talking to, and meanwhile, the hospital is steady coming to Stephanie, which is another stressor, asking for money every day, asking for money.
Every day they bring me a bill every single day. And we had set up a GoFundMe. So every GoFundMe dollar that went in there, when they come with the bill, I was like, okay, today I got X number of dollars. Here you go. You take this. Right. And tomorrow I'll try to get some more. Here you go. Just so that they don't kick him out the hospital, because that was also an option. But we'll talk about that later.
So Stephanie had already started the GoFundMe. And usually, so all the people who really know me that I don't really ask people for anything. I really don't. Usually I'm the one giving. It's usually how it works. Usually I'm the one giving. I don't really ask people for stuff. But that morning I wrote out a very long message for the GoFundMe. I was like, Stephanie, I'm going to write a long message for the GoFundMe, because what we had found out was it's going to cost $21,000 for the transport for Ty from the hospital in Mexico to the hospital in Houston. Okay. And so I got on and I wrote this long message out. One, saying, people that know me know I don't really ask for something. So if I'm coming to you and I'm asking earnestly, I most definitely really need it. And this is to save my brother's life. But the first thing I put in there is I'm a believer and I believe that God will save my brother. And with the help of y'all, it's going to come to fruition. So again, my whole prayer, because again, I'm trying to maneuver all these things, and I'm steady working. And when I see patients every day, I don't get a chance to have no phone in my face. I'm looking at patients, diagnosing, trying to keep myself from getting COVID, because I'm diagnosing children with COVID, flu, all kind of everything. I'm very busy. Spanish, actually, my clinic is all Spanish. All the patients I see are from Honduras, so they only speak Spanish and Vietnamese. That's the only patients I see. So my job is very tough, and so I'm trying to still work and be in my mind and only God, to try to get things done for my brother and not break down, which I did. I had to call my best friend. And it was so much on me. Me and Steph it was so much. When I say I again, I'm a strong chick, and not to say that boastfully, but I was like, it was so much on my head, and I was like, I'm overwhelmed. I called my best friend and I said, I'm overwhelmed, and she doesn't usually hear those words from me. But I need prayer, and I need all my prayer warriors with me. Because I'm overwhelmed, because I'm trying to do all this, and my brother is sick. So I end up talking to one of my good friends. So my girlfriend, like I said, she works for an insurance company, and she asked me, she said, didn't you tell me your brother has insurance from out of Texas? And I said, yes. And she said, well, you can contact them, and they will do an emergency flight emergency transport. You say this is what you request. So she's giving me all the language. And I said, well, but I talked to Stephanie, and Stephanie told me that she called them and talked to them, and they were refusing to pay. I said, but you know what? Let me call again. So again, God is working through everybody. I said, let me call Stephanie again. So I called Stephanie, and this is Saturday. I called Stephanie, and I said, Stephanie, did you actually talk to the insurance company about transportation, or just talk to them about just paying his bill? And she said, no, I only talked to them about paying his bill, because at that time we was trying to get the surgery there in Mexico. So we wasn't thinking about any transport. And so that's all she had discussed, which made sense. And I was like, oh my God. I said, Stephanie, send me everything. Send me all his insurance. Send me all his insurance information. I got on that phone. I called Molina, and I explained what was going on, who I was. I used the lingo and the language that my good friend told me. And the nurse had to call me back. That was on call, and I told her what was going on, and she was like, well, we can't just pay for it from. I said, no. I was like, no, I need the prior authorization form and stuff so we can get the authorization to go get my brother. And she was like, oh yes. So she sent me to the computer, to the website, everything, got the form. She told me exactly what to do, gave me the number to fax it. And she happened to be, now get this, y'all. So again, God, this is how you know he's working. He will send everybody you need, and they will give you signs of its alignment with what he wants. So the first one was when Dr. Atkins told me about his Mexican colleague who his dad is a cardiothoracic surgeon in Mexico, even though we didn't use them. Right. But still, when does that happen? Okay. Secondly, the nurse I'm talking to get the prior authorization started happened to be a cardiothoracic nurse. That was her true training. She's not
now she's working in the insurance, but that's what she had been doing. Because when first she said, well, does he just what we call the flows of the heart? It's this test that we do with the flows of the heart. And I said, no, he has aortic dissection. She knew exactly what I was talking about. And so she was like, oh my God. So gave me all the information. I called Stephanie, emailed Stephanie. We're literally on the phone filling out the paperwork. I'm telling Stephanie what to type in. Okay, get this over to the doctor in Mexico. They got to fill out this part. This is what they got to say. That's Saturday.
And it had to be specific wording too.
Yes.
Because they had to say specifically that this surgery cannot happen at this hospital in Mexico. It had to be spelled out like that.
Right, because it wasn't at first. And I was like, no, Stephanie,
it
had to say that they do not have what is needed in order to, in order to complete this.
Escalate, right?
They don't have it. So we need this emergency. Okay. So like we was going through all that we had to do. And Chris, oh my God, Chris was helping us. He was doing everything, had to be translated. And me and Stephanie, like,
we're in the hospital, and he's listening.
I'm the auntie.
And he's like, and we're like, well, how do we do this? And Chris is on the computer. Okay, I got it. And I was like, okay.
I was like, the young people, thank you, Lord. Thank you, Lord, for the young people now. So, I mean, everything. So they get it. It's a whole kind of hold up with the Mexican doctors because they're trying to do their job. They do multiple hospitalization and emergency room, whereas in the United States, they don't switch. You got a hospitalist that only do hospital, and you got an emergency room physician that only does the emergency room. For these various reasons, they're doing both. So if they're caught up in one, and they can't be about the patient as much as they would like to. And so the stuff still didn't get sent on Sunday. And do y'all know the nurse that was trying to push it through? She was like, as soon as I get it, Dr. Dickey, I'm gonna push it through. Okay. She was supposed to be going on vacation on a cruise. She called me Sunday and was like, Dr. Dickey, we still don't have it. We still don't have the paperwork. She was so concerned for me and my brother. Don't know at all. She was like, we still don't have the paperwork. And I said, I know I'm still waiting on the Mexican doctors to put exactly what they need on there, but it's coming. She was like, I have my home team waiting. And I said, I thought she was supposed to be going on vacation. She was like, I don't leave till 4, but I was trying to call and let you know I'm trying to get it through. Okay. And so we didn't get it to them till Monday. It was Monday.
I don't ask me what day it was.
It was Monday.
I don't even know. We
finally got it to them on Monday. Meanwhile, we're calling. I have Steph on 3-way. We're calling them to make sure they received it, what's going on, because again, she said she had a team waiting to push it through. But of course, the team transferred and they were like, we're on the phone. And we was like, no, this needs to be an emergency.
Right.
And they're like, well, yes, we received it, but emergency still takes 48 hours. Do you remember that?
I know. 48. And they had the authorization.
They had the
authorization. So that's when I put the post up on Facebook.
Well, hold on. No, wait. Not today. Not
okay.
Not
all right.
So they were like, okay, we have to take 48 hours, but they did. No, they came back within that same day. They said 48 hours, but the woman came back.
Okay.
So then I give them the information of the transportation in Mexico that we had found.
Oh, right.
For the $21,000.
Right.
I actually called the man back and say, look, the insurance company is going to be calling you. I chose you out of the ones that we had called. I chose you. They're going to be calling you.
Right.
Well, the insurance did call them. They refused to do the contract. They wanted $21,000 up front. They refused to do the contract. So now we're back to square one, y'all. Days are steady ticking. Okay. We're back to square one. We like, what? What?
Right.
Now we got approval for the
transportation. Approval. And every Mexican company, because we called a couple other ones.
And all of them said
they need to have cash up front.
And of course, that's not how the insurance does it. No. Okay. And so we like, oh my God. Again, a door shut, right? So we like, what the heck? Meanwhile, stressor on Ty and Steph, they still knocking at the door every day saying they Ty need to be kicked out. Like,
right,
he
like
to be
they
put
have
on
a really polite way of saying you need to leave because you have
they just start wielding your luggage.
So because every dollar we get, we were given to them.
We were given to them.
And that so the guy at the desk says, you know what you could do is you could check yourself out and go to the public hospital and wait for your transportation there. So basically they're saying the hospital doesn't have anything. They don't have the dialysis stuff set up. They don't have the stuff that he needs that he's using now in the hospital. So basically they're kicking you out without saying get out.
Right. So this is when we start tag teaming again, and we try American companies, right?
Right.
And Stephanie found the two that said that they had worked with Melina before
and had actually transported to Methodist before.
Right, to Methodist before. So okay, yay. So we get that information to Melina. Now, meanwhile, y'all, I forgot to tell you that Dr. Atkins and his team is waiting for my brother. They get there again. Methodist is used to receiving patients from other countries. So they have what they call a global transport team. And so they had already gotten the global transport. We got all the stuff to them. All the stuff. Stephanie had to go and pay $700
to get the medical records. This is another thing people need to know. When you have your medical records translated from Spanish to English, you can't use AI or Google Translate because, even when you put something just talking to people in Google Translate, it doesn't always come up exactly what it's meant to be. There is a professional service that translates medical records to make sure that everything is 100% correct, because if there's a mistake, that could be somebody's life.
Right.
You know what I mean? If they say you're supposed to have X number of milligrams of something and it's really supposed to be Y, that could mess you up for good, So it has to be done by professional medical translation team,
which we didn't know, but of course the Methodist who does this all the time.
The global team
gave her
said,
the global team.
Well, first the global team sent me the record when the doctor gave me the medical record. The doctor didn't put it on letterhead, and he translated it on AI, and so it's in English. It's not on letterhead. And Methodist was like, you could have done this on your computer. We don't have any proof
legally
that this even came from a hospital,
right?
Because it don't even look right,
right?
So he had to do the whole thing over again on letterhead. Then I had to send it to the medical team, and then this is another thing. By the time I got to the medical team that the global people at Methodist recommended, it was like 7:00 at night. It was late. I didn't even think anybody was going to answer the phone. The guy answered the phone and he was like, well, we can do this. It's going to take about 3 days. And I was like, no, I don't have 3 days.
God,
I have to have this done like by tomorrow, because this was the day before, or at least a day and a half, maybe 2 days before we actually got him out of there.
Right.
So they said, so he went through his people that do the translation, calling them to get somebody to stay up all night and translate this for me so I could have it the next morning.
Yes.
God. Now they did they did charge me for this. Don't get me wrong. It cost me $700 to get all these medical records translated overnight because it was a rush, but they did it. And thank you, whoever you are in the world, for staying up all night and translating these medical records.
So we got that. So they were waiting for Ty. So at that point, Ty had a bed, because that's another thing, y'all. When you're transferring anybody, there has to be a physician to receive them and a bed to put him in. Okay, a bed that you can see empty beds in the hospital, and you'd be like, why can't they go in that room? Well, because you have to have nurses. In order to receive a patient, you can't just have a room, but with no nurse to staff the patient, to take care of the patient, then no. And
there's a difference between an ICU bed
and a regular bed. And luckily for Methodist has their own specialty unit. So they have a specialty unit for every organ system. They have a specialty unit for the ICU or the floor. So he went to the cardiac ICU, not just the regular ICU, the cardiac ICU. So it has to be a bed available, y'all. So with nursing. So at first, he had a bed. By the time all this was going on, they was like,
"Now, when are we gonna get Miss Dee Dee?
We don't have a bed.
I'm texting Dr. Atkins. I was like, Dr. Atkins, they said he had a bed. Now they saying he don't have a bed because they had to contact Dr. Atkins to make sure that he was accepting. He's the accepting physician. He was like, okay, I got it. Okay, now. So this is where my other sister comes into play because finally we get the American flight out of Arizona, out of Arizona, to put the B. So now we find that you had to put this contract in with Molina, the insurance, to pick Tyrone up, and they did. They wrote it up. We found them. They wrote it up. They put their bid in to them, and we're now waiting on the insurance company to accept the bid to get this road. And we wait.
Yep.
After we've gone all these no's, every time we think we move forward, something else happens. Then we get a yes again, and then something else happens. So finally, we're at this point. The surgeon is waiting. The team is waiting for Tyrone in Houston. They're trying to kick him out in Mexico, and they was like, "Look, if he ain't out here by tomorrow, we putting him on the curb." You like what? We putting them on the curb. Now we still paying them every day. Thank you to all friends and family.
Everybody
that sent money.
Yeah.
Right. I'm like,
you.
okay, here's
Believe
Stephanie,
me,
my friend.
I was
said
going
this.
down every day begging. Look, I got $5 more. Can you keep it one other day? You know.
And so my other sister steps in, and so I tell you what she.
So what I did was I put a post on Facebook because I'm like, does anybody know somebody in Molina? Because we need this paper signed. It's because we're down to the last. What's it called? A single something agreement. Yeah. And so we're like, this. If anybody knows anybody at Molina or how to go about this, please know, because we just need this signature. That's the only thing we need to get him out of here. And our sister Ty's other sister Dee Dee responded to this and saved my life. You don't know, Dee Dee, I was crying like crazy because I was like, we have been through so much already, and I was like, if this is just not going to happen behind a signature, then I don't know what else to do.
Take it away, Miss Dee.
Well,
Yeah.
So Dee Dee,
yeah, and thank you for your patience, but I mean, it's a story. So this is where you come into the fray. Tell us who you are and what happened.
Okay. Well, my name is Dee Dee Jackson. I'm a healthcare administrator. So in the United States, they formed a program about 1988 to 92, where they were going to merge medicine, nursing, and business together, so that doctors would respect somebody that had a medical background or a nursing background, and vice versa. And I was one of the first graduating class to do that in 1992. So my background is pre-med, pharmacy, nursing, into healthcare administration. So all those things kind of merged together for the ones of us that decided to change our majors from pre-pharmacy, whatever it was, when they started this program. And the University of North Carolina system, which is where I went to Appalachian State and UNC, those colleges. So listening to this whole story of all the things that you went through, I'm like cringing at the fact that I could have gotten this done in a day. I have the doctors. I know the resources. I know how to get the medical transport. I know what you have to have signed, and I know how to go to a medical director to get it done. But that wasn't the reason the story went this way, because God needed to show out.
Exactly.
Exactly. Because at the end of the day, if I had known in advance and I just fixed it that way, it wouldn't be what we are now. And it wouldn't be the attention that we have to this problem. And when people travel abroad, and not just to live abroad, even when you travel abroad, you have to know certain things before you go. And I wanted to make sure that I was on here today to say that you guys did everything right. There's in a perfect storm. There's nothing. You were 100% on. The only thing that could have been different was when you went to Mexico, what you set up in advance, because you could have gotten sick. That's the only thing you
Right.
can do. And usually people don't do that. That's just not normal. But I want people to start doing that, especially us, because when we're in other countries, whether it's a brown country or another country, we are not the priority. I'm just being
Yeah.
honest. We're not. We're not the
Yeah.
priority in the United States. So we're
Right.
definitely not the priority
That part.
in other countries.
Yeah.
I have helped many, many people get health care, get access, where they were told no, get surgery, hysterectomy, told no, because I know what you have to write, and because I used to review it. I used to approve it or deny it. So fast forward to this story. I logged on to Facebook, and I didn't want to get on that day because I was having a really hard day because I'm post mastectomy and I had really bad news and I had to have one of my expansion implants taken out. And for somebody going through
Mm.
what I'm going through, it's hard to imagine yourself helping somebody else because you're thinking, oh, woe is me. But I logged on, and the very first post, or the whatever the feed thing is on Facebook, was Stephanie's post. Literally, it was the first thing that popped up on my screen. And the Holy Spirit said, someone has it worse than you. You can fix it. And I'm like, but
Okay, Lord.
that's going to take me some time. I'm at the call. And immediately, I just did. I said, I can, and I will. I messaged Stephanie to DM me. And when she did, I said, I can fix it. Give me a few hours. I got the information from Melina. I called into the insurance company. They said the same thing they told you. Exact same thing. All the waiting takes 48 hours. No. I want a medical director. I need a medical transport right now. If he dies while it's in your case being reviewed, it's on you. Everything changed. That's all you have to say. If he dies while you're reviewing it, and I'm telling you now on a recorded line that he needs it, they will play this tape back. I will testify so they can sue for everything that your company is worth. I said that. You have to be able to communicate with them in a language they will understand. A death that they're going to be responsible for, a suit they're going to be responsible for, and you can save his life. Those things were all said. Within minutes, I got to the utilization review nurse. We talked. We understood each other. We can talk the same language. I told her the same thing. I said, I know you can't approve it, but your medical director can.
Right.
We don't have 48 hours. We need the signature now. I need the signature by 1 o'clock.
Right.
She was like, well, it's already something till 12. I said, I know. I need it by 1 o'clock.
Thank you.
Because I need to contact her to let her know he's leaving today. And if he can't leave today, he has to leave in the morning. It's got to be done. She says, I'll try. They'll give you a call back. I said, I'm going to remind you again. But if he dies while you're reviewing this and you're making these phone calls, there will be a medical suit. I do medical lawsuits as well. I'm the one they call. I'm going to testify. Because this is just a waiting game at this point. And someone's life hangs in the balance.
Right.
When you've got 15 days or 6 months because you've already been in pain for something else, they're not going to rush. But that's why you have to make sure they know the critical situation they were. I said, and I would explain to the nurse again, you know what an aortic dissection is? I know what one is. Lay people don't know that. We do. So you are responsible for me giving you the information. So now it's on you. She has to take the ownership. Oh, she didn't want that. So immediately it got to a medical director.
She had to answer that phone.
Right. She was like, I wasn't even supposed to get the call. I was like, I understand, but you did, and we're going to talk about it. So she literally said that, like, I'm not supposed to be on the call. There's somebody else. You're on the call now, and you can't hang up on me because if you do, that's your name already. So I was writing down names, I was writing notes, and taking names like I was a review nurse again. And she was like, excuse me. I was like, oh, your name is? I was repeating names. And I said, I said, my name is Dee Dee, but my legal name is Donna. So I'm letting them know who I was, what my credentials were. I said, and I got, cut my teeth on one of the roughest hospitals in the United States, Grady in Georgia. You probably heard
Oh,
of it.
Lord.
And so they were like, yeah, We have. And so anyway, we get to the point to where I said, I'm calling back, and she said she's gonna call me. I didn't wait. It was 12:45. I called back. I got another person because the lady that I was talking to was supposed to talk to someone else. And she said, "Is this Miss Jackson? Dee Dee Jackson?" She said, "Yes." She said, "Hold on 1 second. They want to talk to you." I'm like, "They want to talk to me?" So they come back. The nurse comes back, and she says, "Miss Jackson, they pushed the medical review through. All the things you said, we didn't have that information. We didn't know." I said, "Excuse me? You had the information. You had not reviewed the information. Do not say on this recorded line you had not received the information, because I know that you had, because they'd already communicated they needed 48 hours to do it. So don't do that.
Right.
Don't do that. You had it." I said, "What I asked you for was an emergency review. Did you do that?" We did that. They're going to have the response by 103. I said, 103, that's an odd time. She said 103 because you gave us to 1 o'clock, letting you know that it's going to be 3 minutes after 1 before we can transmit it, because we're trying to get the paperwork together to get him to sign it and get it to him. I said 103 is not 1 o'clock. And she was like, "Was there going to be a problem if it's 103? I said it could be. So I I hung up with them, called Stephanie, and told her what was happening. She said, "Dee Dee, it just came. It just came. It was before 1 o'clock."
Right. And the airline and the air transport people called me and said, because they needed some more information, and they said, "Tell me now, because we only got an hour."
We only got an hour. Yep. And I told them that I wanted it to be everybody done. I wanted it to be that medical transport done, the review done, everything done by 1. They got it all done before 1. But I said all that to say, it wasn't a scare tactic. This is the actual business decision that needs to be made. This is the business part of medicine. And people often forget. And his sister reminded us that medicine is a business.
It is.
And they are going to make their money somehow. Right. They just need to make sure that they're going to do the least passive resistance to lose money.
Right.
And even the hospitals in Mexico, because they have the free healthcare system, if you're over there, they want you to pay if you can. If you're in a hospital that can pay. The same here. If you're in a hospital in Georgia and you can't pay and they can transport you and you're safely stable, they're going to transport you to Grace.
Right.
Because once you're stable, they can do that. I had to remind Melita he's not stable. He was supposed to pass away days ago. I mean, days ago.
Right.
So this patient is not stable. He's just here by the grace of God. You know, it happens. We have patients all the time, and they say you only have 3 days, and if we don't get such and such done, you need a transplant or whatever. I'm trying to get a transport team together. They live 10 days. We get a transplant. But the bigger thing for Steph and Ty is that they were calm through this. Ty, of course, because he was in the hospital, but Steph was calm enough to know to keep trying things. Put it out on Facebook. We need to use social media to our advantage.
Right.
Put it on Facebook. Somebody out there may know. I saw in the stream. I thought, well, maybe somebody already fixed it. Let me read before I, do it, because I really want to be, in my depression right now. I was reading what they were saying. I'm like, oh no, that's wrong. Don't do that. Don't do that. Don't do that. So I finally I said, no. This is what you need to do, and I'll just DM me. And because people will give you information, and it would have worked for certain things, but not an international transport. Those are, what you can do in the United States and different things, and specifically to Mexico, because all international transports are not the same from every country. And that's why I said, if you're going to live, in another country, and you're going to take residency there, that's a different thing. But if you're going to be there like on a nomad visa or however you're going to be there, it's good to know what your benefits are in advance. Even if you're not sick, like I heard, we were talking about earlier, somebody said, if you're relatively healthy, you should be okay. That can change in an instant. My husband was relatively healthy and had a seizure out the blue 5 days before my mistake.
You can get hit by a bus, anything happens,
And so my thing is that when you're preparing to travel to live somewhere else, even if it's permanently or 90 days there, you have to come back to the United States for a week and then go back. However you're going to do it, you need to, the same way you're going to pack your clothes for that season, you need to pack your health care and your plan the same way. And one of my friends was like, you need to start a business where you help people to do this because we don't want to always be in the United States. And I know this might be transferred anywhere, but I'm getting ready to have my nomad visit in Spain personally. But I need to make sure because I'm on disability in the United States that I can have all of my care there. I have autoimmune disease and BRCA2 positive, a lot of things. But it doesn't mean I can't travel and I can't live somewhere else if my plan is in place. Because a plan in place means I'm just a jet away from getting home. Or I can find somewhere in another country that I would know what I can have, where I can go to get my things treated. What Ty had was what we call a critical emergency, an urgent situation that happens. You don't know what's going to happen. You don't know you're going to wake up and your air is going to happen. You have a tear in your heart. Those type of things you can't prepare for. That's why people should have, critical care insurance. Those type things can help you to have the things when something's not going on. And the medical doctors will take care of you. But like they say, if we don't know what the insurance is going to do, their hands are tied. That's where you need someone with an insurance background, healthcare administration, someone that's going to be able to help you to make the best decision, not just for your life insurance, but for your health insurance, what you choose, and what your rights are as a citizen in another country. And different countries have that. You have rights. Because the first thing I did was I called the American consulate to make sure that what I was going to do was legal and just to say that to get this United States citizen out. And it was, and that's why I went the route I did with telling them, you got a person that's a U.S. citizen. You're not getting him out of Mexico in time. If he dies there, it's your fault. Those things become legal and true in a legal situation, like an untimely death or a death situation where someone had to be sued because they did something wrong. Those things matter. You're going to know that though if you went to school, you took a class on that. Because we had pre-law classes. When the degree that I had was for if you do medical law, you do medical review, you do your nursing, we do ICD-9, CPT coding, it's everything, just a hodgepodge of stuff. So you can communicate with the right people, and that's how I knew exactly what a mental transport was when I saw it on there. Aortic dissection, his diagnosis, I knew all the way around what it was, which is why I knew that I could. When the Holy Spirit said you can do it, because I don't have the gift and training that I do because I just woke up with it. God blessed me with a brain that can hold that kind of capacity and then the sense to be able to go to school and get a college degree for free on a scholarship because I wasn't going to get one otherwise. So all those things that she said came to fruition, happened, and I'm glad I was part of the perfect storm because no matter what everybody did to get to that point, I told Stephanie, we can't let this not happen because of a medical transport signature. And that was where we were. You can get stuck. Even in the United States, though, guys, it happens. You're waiting for something all the time. A baby's waiting to get some kind of procedure or a prescription to get their skin taken care of. You're waiting for somebody to review it. The baby's their rash is so bad, they're now needing another procedure. They need something else. So now they got to go on steroids because they're inflamed. It's just it happens. And what I do here in the United States, your friends, family, sorority sisters. I mean, and then their friends, family, sorority sisters. That's why it's gotten to be so big. Everybody's like, oh, they always call me because once they know you can help, they want you to help. And then I try to teach them. And every time I do it, I want to leave that person better with what they want or my information. If you're ever in that situation again, please call me. Like at the very beginning, whatever it is, just call me. And so they know that. And I've kind of tried to do that. My husband says the same thing. I know that it's a thing that's needed because whatever we are now, what are we, Jen, whatever I am at 55, whatever my thing is, we are not all going to want to stay here all the time. We want to travel the world like everybody else, live in other countries for a month, do whatever we want to do. And that's why I want us to understand that we can do those things, but we just got to prepare for it.
Got to be prepared, And I think something that's left out of some of the videos that you see.
Right. When you talk about leaving, they don't talk about that. They don't talk about, get your health care in check, make sure you can get a medical transport, make sure you can not just get a helicopter, you want a jet. I told them, I said, I know you're going to do this. By the way, we're not going on a helicopter. We're on a jet.
Right.
That's
Right.
how you got a jet.
Right.
Because the helicopter is gonna be too tight, can't move around. If wife can't get in there, no, they're all going together.
Right.
So even
Didi,
that,
Right.
right?
And then even after this,
Didi,
Uh
I love you for the jet. I love you.
Give us the jet. If we're gonna
Thank
go, we're going
you.
first class.
impressed with the
Thank
jet.
you. The nurse opened up the door when they got me on the tarmac. He opened up the door. I'm looking. I'm half comatose, right? But I'm
Right?
like, wait a minute, that's a jet right there. He said, you never been on one of them? I said, no.
No?
He said, okay, well, we got you.
Yeah,
So
yeah.
thank
It's a
you.
different kind of travel. It's a different and to be and really,
Man,
if it
they
had
hurry
not
up,
been,
got me in the sky, and we
yeah,
got the
you was back
moving,
home
Jack.
just like that. And that was the other thing about this. A helicopter would have taken longer. It's a rougher
Yeah.
ride. It's a choppy landing, a choppy takeoff. Stephanie had told me that you were critical. You're in and out.
Yeah.
I mean, I already knew she'd be
Yeah,
in and
be
out because you
stable.
were not
Right.
supposed to be here 10 days
I
ago.
didn't even
And I'm like,
honestly.
that's it 10 days ago on Facebook. I thought he was supposed to already be in Houston or gone or out somewhere. I just thought that it was all worked out. I didn't
Yeah.
even
Right.
know the in
Right.
between part that you
And
guys were doing.
it was still a
It
challenge
was
getting him there because
Right.
I had to tell you what happened at the hospital, getting him out of
Uh,
the hospital.
well,
Okay.
before we get
uh,
to that,
What?
this jet part. So in actuality, Tyrone did not. He could not have been put on the helicopter because the
exactly.
machines alone couldn't even fit on that he needed to
Exactly.
Right.
survive.
That's
Could
true.
not
That's
Exactly.
true.
fit on the helicopter. So it was no
Right.
way in heck
True.
because his critical condition.
Right.
There
And
was
Right.
so
no way
that's
in
what I
heck
had
he
to
could have been
communicate to
on the
them.
Right.
helicopter.
That's what I
Right.
had to communicate to them in
But
advance, nurse to say, look, he's not going to be able to do just a regular medical transport, like to fly him out
no,
from a helipad. And she was like, I
And
know
this
that
this
until
company
we went
came
behind the scenes.
all the way
Right.
from Arizona
yes,
Yep.
to
To get him. Yep.
Mexico to come get
Yep.
to
him.
come and
And so they had
y'all.
to find the right one. They had to make sure that which they'd already like been talking to you guys about it. Make sure it's going to be all of his equipment could be able to fit on there. The energy was going to be efficient. The electricity was going to be good. I mean, everything had to be worked. Made sure I wanted
Right.
everything. Make sure everything is in place so that there's no emergency in the sky. There's no
Right.
emergency while he's in the jet flying to Houston. He can have the smoothest
Right.
ride, no bleed. You have backup generators in case the power goes. All of that. You have to think like that when it's a critical transport like this. And so, of course, they did. This jet was great. You guys said that it was, appropriately fine. It was the best
Mhm.
way you were going to
And the
go, and it
and the
I think
happened.
they
company
even had
arranged for
pretzels and a
everything
Sprite
for
for mommy.
the ambulance to the
Yep.
airport, and
Hmm.
then the ambulance. It was door to
Yep.
door service,
Yep.
and then the
Yep.
ambulance
Wow.
from the jet to
And that was part of
Hobby
what
Airport
I
to
negotiated. I
Memphis.
did talk to them about making sure that they didn't have to have any more services from the hospital transporting back and forth. That's more money for you guys. I said it needs to be they take over from getting him from the hospital to the jet, from the jet to the other hospital, because
Right.
that's
Right.
what could all be because all of that technically is covered. So that takes that
Right.
portion off of you saying, well, we're going to charge you $1,000 to get him over to the jet. But we
Right.
don't know. I mean, I'm just making that number up, but it could have been
Right.
$1,000. We don't know. But we needed the Melina to take over from the pick up the patient, get him to the jet, over to. They're like, oh, so they're gonna bring him to the jet. No, you're gonna get him from the hospital to the jet, from the jet to the to the other hospital. And they know they can do that. They just want to know, is this what we're doing? Are we doing
Right.
all three pieces of this, or what pieces are we doing? I said, I'm not sure what they said you were doing. I'm saying you're doing from the hospital to the jet, from the jet to the. That's what I'm saying. So that's what you need
He
to
taking
send
the
back as
Uber.
approved.
Okay.
And
Right.
that's what they sent
Right.
back. So they said, well, we
And
don't have any specifications. And I said, well, now you have specifications now. And so they were like, well, are you authorized to do that? Well, I said, you have to remember, she already gave me authorization way back when I was talking to the nurse, 3-4 hours ago. And they were like, oh, yeah, we do. We have it right here. So, yes, this is what we're going to do because that's what's covered in this transport. And I knew that.
Yeah.
So
right.
that was just, like I said, even that kind of thing, that's a small thing. But when you're
It
over
goes
there
to the
paying
picture, I
by the
think.
day, $1,000, $500, that's not a small thing.
Yeah.
No, it's
Yeah.
not.
So it's
Yeah.
not.
$21,000
Every
is not a
dime is
small
important.
thing.
Every
Right.
dime is important.
And
Right.
So, but
and it
anyway,
was covered, y'all. It was
it was
covered. So
covered. It was
when I
covered.
called Melina and talked to the nurse originally, she looked at his insurance and said, it's covered. It's
Right.
actually was a part of his insurance. It was
And
It
ask
was.
me, do I know that? I bought the policy. I
It was
bought the
covered.
policy. You read the policy when you buy it, and then you don't think about it again.
Right.
And when you know, and
And you probably don't get to that portion. It's just way down in there.
I
And
know, I
when you
know. You
said it
go
to
down
me, I
to the
was like, oh,
bottom
it's
and you
covered.
sign it, and you saying, okay, it's okay. I had no
Right.
idea it was in there.
It was
I had no
actually in
idea.
there. She was
And
like,
even
no.
if you read it, you're not gonna remember it because it's the last thing.
No.
Or
ever
really
did.
understand it. A lot of stuff,
Yeah.
you know,
Yeah,
was
and who thinks that they're
being-
going to be an
Right.
emergency
And that,
evacuate?
yeah, that's
You
what I was
know,
saying. When you plan it, if you have a connection to someone or that would be, because I would have known, I know immediately. I'm like, oh, this is Melina. I just Googled Melina right quick, put up their thing, and looked at their abroad policies, and I knew that it was covered. But
Mhm.
I didn't know to tell you that because I wasn't looking on Facebook. Like you said, how would you have known? But what we're gonna have to do is keep teaching people and letting it go out. This podcast
Right,
will teach
right.
somebody.
And
It
that's
may
part
save
of what we
somebody's
really
life.
want to accomplish with this too, is to make people
Right.
think
It's
about all
education.
the
Yeah.
things that can happen, excuse me, that can
Right.
happen and what needs to be taken care of in
Right.
advance, because you don't know how things are going to play out.
You
You
don't.
know,
Yeah.
since so many
Yeah.
of us are at a certain age and we're leaving,
Right.
that adds another layer of caution that you need to take,
Right.
because you're not as young as you used to be, you
Right.
know.
And
Right.
And
if I
then,
could throw this in too, it's not always about international travel. Are we
No,
covered
it's
even
right,
just at
and it's
home,
domestic as well.
domestic?
I mean, I do
right.
this even on U.S. soil. I do this as much. Well, I mean, all the time. I mean, I have
Mhm.
friends all the time. I mean, need the hysterectomy, needing the breast reduction. It's whatever it is you need. It's critical to you, whether it's
Mhm.
critical care or critical, quality of life. It can happen right here in the United States too. It's literally you
No.
can get caught up in a system that's putting you in utilization review. They're giving you, okay, it's going to take 6 to 8 weeks to review. That's 2 more months of whatever you're going through when it really is critical. And I know that as a utilization review former, person that did that, oh, you would have been moved to the front of the line. You need to say this. We need to say that. We need to do this. Let's get on the phone
Mhm.
together because I always offer them to get on the phone together. I will
Mhm.
talk for them. I will speak for you because even if I tell you sometimes, you might not say it the way I'm going to say it because I'm very forceful because I've had to always be that way in this
1 o'clock.
industry.
Me
At
too.
one
Yep,
o'clock, I mean, is
yep,
103 going to be a problem? It's going to be a problem. It's
yeah,
going to be a problem because
yeah,
if I'm telling you it needs to be 1 o'clock, why do you need 3 more minutes? That's what I want to know.
right,
Right.
What are you going to do
right,
in 3 minutes you could have did before 1 o'clock? And I talk to
Right.
people that way because are you playing with me? Because you're playing around me. Because at the end
yeah,
of the day, it's I, I don't even want to get into the other things I think when people do stuff like that. And
Mhm.
I mean, I don't know if they understand from my voice that I'm a woman of
Mhm.
color or
Mhm.
they don't play with me because I know what I'm doing. And I can talk to your medical director or I can talk to the person mopping that floor and get this done. But we gonna get this done today. So I know that my husband tells me all the time, if you weren't as forceful as you were sometimes with all the things I've heard you help people with, it would have still gone another
Mhm.
way. And you have
hmm
to sometimes, and I know, she knows as a doctor, you have to sometimes play hardball with them the way they're trying to play hardball with you.
Most
Mhm.
definitely.
And that day, look, I was up for it. I had the time. Okay, I'm retired anyway, so I always got the time, really. So my friends were like, you got the time." I do have the time.
Mhm.
I have the time. And so yeah, I'll make sure I leave my email address and y'all can get my phone number out too, because I want anybody that sees this. I don't care who sees it or what.
Mhm.
If they need help and it's
Mhm.
related to doing
hmm
anything in a
Mhm.
healthcare system in the
Mhm.
United States or abroad, because even if it's
right,
abroad, I can translate and get it up to speed on it. It doesn't matter. We've
hmm
got lots of resources that can help us do that, and we
right,
can do that from country to country. And it is different, but I definitely want to make sure that people know that I'm a resource if they need one. And there's other people that you can find probably in their local areas. But since it's the world of living on the internet, it doesn't matter where I'm at. I'm here. So
That's
you can
right,
reach out to me. I'm a phone call away or an email away or text. If you text it is good too,
Mhm.
hmm
away. And now they have a resource because again, I
right,
just cringed the whole time listening to the story. I was like trying
Mhm.
to, I'm like, oh, trying to, ooh, I could have just, all those things that could have been changed. So when she said she had to go to Mocha Medicine and we had to find it, and I'm like, I would have just went there. It's just all of the things.
But
But
may
these
I
networks
ask
that
a
we,
question?
what?
Ask a question. Um, and it's a blessing that first of all, that we're literate, we have some level of comprehension, but then it's an added blessing that we have doctors and folks who are degreed in this situation, right? But to your point, you were cringing through the story of it all.
Right.
So where does that leave the regular person?
It leaves the regular person. See, y'all.
You understand what I mean?
It leaves the regular person.
It leaves
very
lacking.
vulnerable.
Most of our people. That's why we died the most. Y'all.
Right. And
that's
so
why we
even in the
died the
United
most
States,
because
we are the most. Even in the United States, when she says lacking, it's even strong. We're vulnerable. We are. It's like we are a prehistoric creature trying to survive. And if you don't have the information, you won't get the basic stuff like diabetes medication.
If you don't have anybody to advocate for you
and that's
push,
the number, and that's what I am. I'm a medical advocate.
And it doesn't have to do this. Let me say this, and you see, I set up because it has nothing to do with money. It has everything to do with that we are Black and minority. If major celebrities, that's why we have such a high mortality rate for our pregnant, because it doesn't matter about money. You could pay, you could be a celebrity and pay, and they still will not believe you about the pain you're in, what's really going. You're telling them there are symptoms, and they're still not cluing in to what's really going on. Even if you have past medical history of something, they're still not cluing in and believing you when you are telling them what's going on, and they're still holding back from the true care that you're supposed to get. And you're a celebrity and can pay for the whole hospital, and still, if it's not for you advocating or having other people advocate and push and use some of this jargon of we're going to sue you for this, this, and this if this happens. See, that's the only thing they get to understanding. If you notice when you're in somewhere medical, and if you start saying any type of medical terminology of any sort, they start, oh, you're a nurse? Because it's the first thing they say. At first, they never think you're a doctor.
You're a doctor.
Are you a nurse? Not to say anything is wrong with nursing. Sure, we need them. But are you a something? So they start to ask, then things get to changing. And it shouldn't be that way. Everybody should be treated fairly. If you're sick, hurting anything, it shouldn't be that way.
Well, I can testify to that, Rhonda, because I while I was in the hospital, all I heard was, "Oh, your sister is the doctor," and it was a whole different vibe.
But to her point, though, when we're talking about people being vulnerable and needing medical advocates, when people are in the hospital, when they go into a bathroom, on the back of the door of every restroom, it says, if you're being abused or hurt or whatever, you can call these numbers, right? What they need on the back of the door is if you're a person of color or any person thinking you're not getting the medical treatment that you have, you can call this number and do that. That's what we really need. Because at the end of the day, I have had to, even for my own self, while I'm in my own in a hospital, myself, do medical advocacy for myself. And I'm the patient. And I tell people, if I had been in a coma, my husband is an engineer. How is he going to do that? So I have now started, because I have critical conditions, started training my children what to say, training my husband what to say, and I've written it down. If you don't remember, read this to them.
My mama said by 1 o'clock.
Right. Exactly. So, and when I was in surgeries different times, my daughters, they got right up on their phone. This was going to happen. This was going to happen. And the nurses treat me totally different when you have I tell them all the time, I have a medical plan in place. I have a medical critical plan in place for anything that happens while I'm in this hospital. My daughters have it. My husband have it. My children, they have it. So they know, it puts them on notice that if something goes wrong, there's going to be somebody looking. There are going to be questions. If she needs pain medicine and she has to ask twice, they're going to know about it. If she, the things have to be said. And I tell people all the time, there's nothing wrong with going to a procedure or a doctor's office or anything, letting them know in advance that you know what your benefits are covered.
Right.
Listen, I already know this is covered. This don't give me that medicine right there. I don't want lisinopril. That right there causes that cough. I don't want that. I want the one that don't cause the cough or epilepsy. I want that.
Right.
Let them know. When I went with my husband to the doctor, I'm like, oh, he's not getting that. That causes epilepsy. He's not getting that pill right there. You have to let them know sometimes that you've done your due diligence.
Right.
And whether you're a doctor or not, if you say your due diligence is correct, they have to at least adhere to it. But a lot of times, people are nervous or they feel inferior to nurses, doctors, healthcare administrators. People are talking to them. I tell them all the time, you are the customer at a hospital, a doctor's office, or an emergency room. If you understand that your position is the position of power, they only want to keep it, but it's really yours.
Okay, so
That's
I'm gonna be really
different.
honest.
Go ahead.
And I'm being really, really serious about this. I feel scared to speak up like that because and I'm not trying to sound funny. They're gonna happen to, take my blood again, or they're not gonna be able to find my vein for the 5th time, or they're gonna make me wait longer. I feel
Why are you
I'm
scared?
at their mercy. You know what I mean?
But why are you scared? Why?
Seriously,
What?
because I am the vulnerable one. I'm the one who needs to get poked and prodded. I feel scared if I go in there saying all
I
that.
think that you're scared because you've been conditioned to be scared. When she talks about us being inferior here in the United States for getting care, as a black woman, you've been conditioned to not be listened to.
Yep.
So I need you, let me make sure my little earpiece is in,
And
to take back your power. You have no business feeling inferior to anybody on this earth because you're a child of God. First of all,
that's true.
and second, I don't think there's any female race in this world that has carried the whole effing world on their back more than we have. Okay, so it's not being an angry black woman to ask what you need. It's not being a person that's being out of order. A person because you're trying to be. You just got to educate. No, I'm trying to live.
I agree.
And you trying to live is an urgent situation.
Right.
And I feel like when you feel but you're not the only person. Every woman that doesn't have some sort of history with being, either a nurse, doctor, healthcare, whatever it is, could be vulnerable to that because you've been treated, whether you believe it or not. We've been conditioned from little not to be heard in the doctor's office. I've had 5 children, okay? And my 5 pregnancies evolved to get better and better. You know why? Because I remembered that I'm the patient. I'm the customer. You're not listening to me. When I was in North Carolina, it was going to be this way. This. I had hypermesis really bad. But I had to make sure they understood that I'm not going to do this treatment. I'm going to do this treatment. I'm not laying in the hospital all this time. I want to go home on an IV with a medical nurse to come check me every day. And I had to insist on that. Or they kept me in the hospital for 7 months on an IV, and I could have just been at home. There's no difference. I could have been right at home. And I had to make them do that. From that pregnancy to the 2nd, 3rd, 4th, 5th, all of those pregnancies, I had to remember that it evolved. And each one was different, and each one needed different things because I aged. I had my first child at 25, my last child at 38. So at 38, you don't listen to me. Because I'm making sure I don't die here. Because the morbid for a woman at 38 is black, your chances of getting out of there is probably 50% sometimes. And it shouldn't be. You should be, if I go in there and I have a baby and an hour later I have a bad headache, they should hear me. They should check my blood pressure more often. They should make sure I don't have a bleed somewhere. Is she still bleeding? They don't do that a lot of times. You're just in pain. You're in labor for this long or whatever. And I can be like, I wasn't in labor. I'm at a C-section. Because you're conditioned to say that. So I've told
Jackie, we lost your camera. Hold on.
there we go. So, but I do understand. I totally understand the fact that you feel that way because you've been conditioned to feel that way. It's subliminal. and it's overt. And I'll give you the worst story possible to tell you. I'd have a mastectomy, okay, which is already horrible for any woman to have to go through, right? So when you have a mastectomy, you have decisions to make. What kind of surgeon you want? Do you want reconstruction? What if you want reconstruction? What kind of reconstruction do you want to do? You know, a flip? You want to do this? I mean, there's all kinds of things. Implants, all those things you have to go through. Me and my husband are the people that were going to make those decisions for me. No one else. So I wanted to make sure that was clear. That's why I'm saying that. Unfortunately, I was at a major institute here in Atlanta, the number one here. Won't say it on camera. And I had a great team. They got me all the way through to the BRCA2 diagnosis, all the way to I had precancer cells, all of the things they had gotten me there. So I was so thankful for that. But God had led me to them, so that's what they did. But I ran up on one surgeon, the one that was going to be my plastic surgeon, because my husband and I decided that for me, what was best was we were going to do implants versus any kind of flaps or anything else because my body, I'm thinner, I don't have any to do that, and it would have been too hard. And after they told me they couldn't take from my thighs, I was like, it's a wrap. I don't have anything else but thighs. And so he said, we're going to do the implants. And we made that decision together, he and I. He's been in every appointment, and there's been 100 of them or more, I'm sure. Okay? So he's my back. We got to see the surgeon that was going to do my reconstruction. I was 7 days out of having my last ovary removed because I was potential ovarian cancer because of the BRCA2 diagnosis. 7 days post-op from that, you know, you're still pretty sore, you're going through some stuff. So I see we're in there. And so she was talking really fast and she was telling me what I could and couldn't do. But then all of a sudden she said, are you okay? Because I started crying because I was just in so much pain and she was just not listening to me at all. Every time I tried to say something, she'd cut me off. My husband then put his hand on my shoulder and said, she's trying to tell you that she just had surgery and that these were the plans we had. We have it all written down. Like everything that she needed to say, I have it. Like on his phone, he had it right there. And she said to him, well, I don't even know if she's ready for reconstruction. Maybe.
Can't hear you.
I think we lost you there.
Yeah, what happened, Miss T?
We can't hear you. Oh.
I'm sorry. My
There we go. We got you.
phone rang. So here we go. We got me. So she said to me, maybe you should just have a mastectomy. And when I determine that I think you're ready, then we could go through the reconstruction. So she wanted me to remain flat. Do you guys know? So, woman, you telling me that you're going to decide when I'm going to get reconstruction for my breasts that they're going to be removed. And she was not a black woman, but she was a brown woman. Okay? And sometimes in the United States, that's a problem for black women when we have other women that are not black, but they are still a minority. We get treated even worse. Okay, guys, I'm being honest. We do. We do. And we know it's true.
Yes.
Because I've got tons of people that can tell you.
No, it's true.
You know it's true. So when she said that to me, I said, who do you think you are? You're my surgeon. You work for me. I said, but you don't have the power to tell me when I get the reconstruction. We chose day one reconstruction, which means you do your mastectomy. And then when you do your mastectomy, you have the plastic surgeon come in and they do they begin your reconstruction process. She said, yes, but maybe you're not mentally ready. Do you have a therapist you're talking? I mean, man, now you're going to my mental state. I said, first of all, you disrespect the fact that my support system, I'm married to him. I'm married to him. He's been here. He's been every appointment. And now you're asking if I'm mentally stable. I said, well, as a matter of fact, I do have a therapist. That's really none of your business because that's private. So I said, you know what? We're gonna leave. We're gonna think about this. I talked to my therapist about it actually. I just got this one, and she had my sorority sister. She'd gone through the same process, but she didn't have any of that problem. She said, Dee Dee, you know what you got to do, and I said, I know, and I had to divorce my doctors.
Exactly. That's what I was going to get to.
Doctor. I said, yeah. She said, you already know what you got to do. What would you tell one of your clients, one of your patients? I said, you got to divorce that doctor. You don't negotiate with a doctor. They've already told you something they were going to do. She might mess my breast up. We're not playing with you. I divorced her. So before I even divorced her, I did my little research
And found
went
somebody else.
through. I wanted the top 10 surgeons in Atlanta. I pulled their pictures up to make sure I could see who they were.
Yeah.
White men, nope, 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 nope. Black females, I'm going to her. Went to her, told she already knew my story because she got my information from them. She's I know what happened. They told me about were you prepared? That she said I'm sorry that happened to you. I had a mistake to me as well, and no one ever mentioned to me about was I ready for my implants. She said so. I apologize for that happening from my other medical colleague. I said you have to apologize. I said it's okay. I said you were supposed to always be my surgeon. And so the person that was going to do my mastectomy, when she got ready to leave out, she said, "Thank you for being brave enough to divorce the doctors you had. I appreciate you trusting me coming." And then she said, "It's going to be okay." I have this necklace on right here, that I always wear. And so when she went to go out the door, she leaned down and said, "They don't know who we are anyway." And I said, "Excuse me?" She's my soror. So I ended up having a sorority sister do my mastectomy, and a surgeon that she knew who was very good here, at a renowned, actually top plastic surgeon in Atlanta, became my plastic surgeon, and everything went perfectly. And right now, I'm getting ready to. I'll do the rest of my story in a few weeks, where he'll finish, the implant. But I said all that to say, had I been a woman that was fearful of speaking up, I could just be walking around flat. Or I could have thought, or they could have told me you don't even get implants, or you're not qualified, or something happened. When things in this world happen to us as women of color, United States, out of the country, wherever we are, we better make real sure that we're prepared to stand up for ourselves. And if we can't do it ourselves, have someone advocate for us. That's why I want to make sure that I came on to make sure that we do that. So you don't ever have to be that way again, because you know me. So if you don't want to say it, I'll say it for you.
Yes,
absolutely. Let me jump in here because we are running up against time, and I want to kind of close us out here. If you guys heard this story and you were not inspired, then you are not listening.
I know.
You should be inspired to, strengthen your faith, strengthen your information, and strengthen your preparation. So you should be, ready to get yourself together and be prepared. We'll leave Miss Dee Dee's information down there so you can get in contact with her if you need some advocacy help. And I want to leave the last word with Tyrone here if he has anything he wants to share with the audience. If you want to close it out for us, Ty.
Hey man, I just want to thank all of you guys. I really do appreciate you. And thank all of the people. And it was countless people who just, sent in well wishes and, checked on me and stuff. And I do appreciate it.
Awesome. Thank you so much.
And,
Again, you're watching Seven.
and Dee Dee, I could never thank you enough.
You're very deserving. I don't want you to ever feel like you weren't, but when he did what he did, which is our Lord and Savior, it was for a reason. He'll tell you. And it might just be to be the advocate right now.
That's
it
the other
could
thing.
Be to be a health advocate, because once you've gone through a thing, then you can speak on a thing.
Yes.
Right.
Only when you've gone through some things, the Bible says you were tried by fire, because not everybody can speak on conditions like what you've been through. I've been through a similar condition where I could have died, 3 times actually.
But media, if you need help, let people know what you need.
Yep, let them know. Put it out there.
Yeah, and a lot of people don't do that. I have a friend that's very sick right now, and she says, and she's, I said, I haven't seen you on social, she's like, no, I'm really sick. I didn't want to let people know bad it was. But you need to let people know, because that's the only way like they say, closed mouths don't get fed. You need to let people know so you can find out if somebody can help you, because we're not in this world by ourselves,
And I want to make sure
resources, angels.
Right. And I do want to make sure I let you guys know that now that you've gone through this, I want to make sure that you guys know also what I also want people to do is, now that you've gone through this critical care situation, Ty, you guys also are qualified for other social benefits in your community. So if you need help with getting food, if you need help with getting food or utilities or different things done, because you are in a situation right now where you're in treatment, you guys can do that through several agencies. United Way. If you need help doing any of those things, reach out to me and I'll give you some resources. And those resources transcend we're in the United States. United Ways everywhere. There's lots of things, and many churches and many social organizations as well help people and do benevolence for people that need that. So don't try to do this by yourself because you're still healing. And Stephanie, you're a caregiver now. If you need
Yeah.
respite care for him, you need to go do something. There are people that can come in and help watch Ty. When I say not watch, but help with him to make sure that
Right.
he gets his food done, and the house cleaned or whatever. People would volunteer to do those things. Just those things are available too, but people don't know that it is available.
Right.
But you
Oh,
you need a lot more things for a long time, and so you
Yeah.
need to make
yeah.
sure that you're getting those things.
Right.
Well, I definitely will contact you because I
Yes,
didn't know.
please do that.
Yeah.
Please
She's
do
a
that.
Okay.
gift that keep on giving.
Yep.
Thank you.
Yeah.
And thank you
Yeah.
both,
Absolutely.
Chris and Jackie, the
Thank you for
799
having this program.
channel,
Yeah.
for letting us talk
Yeah.
about
Oh,
this.
yeah. Yeah. Thanks,
Yeah, we really
guys.
appreciate you
Thank you
guys
so
because I
much.
think this
Yeah.
information that people need to know.
The only way
Absolutely.
it's going to
Absolutely.
change is to teach people and to talk about it. Because word of
Yep.
mouth and social media is the biggest form of education there is that we have right now. It is.
Yeah.
Right.
It's all it is.
Absolutely. Absolutely.
Yeah.
And on that, we'll close it out and we'll see everybody next time. As always, Cuídate, Arias Garce. Take care and take a chance.
Take care,
Peace,
guys.
y'all.
Yes.
All
Thank
right. See you
you.
Bye.
guys.
Bye.
Bye.
Thank you. Love y'all.